Good morning, everyone. Thank you for being with us here today. I am going to turn things over to Don Davies to speak about this important bill.
Good morning, everyone, and thank you for being with us. My name is Don Davies. I'm the New Democrat Member of Parliament for Vancouver Kingsway and Canada's NDP critic for health. And I'm very pleased and honored to be joining you from the unceded traditional territory of the Coast Salish people, the Squamish, the Musqueam, and the Tsleil-Waututh, by whose grace and generosity and permission we gather. I'm so excited to be with these wonderful people here today as we launch a piece of historic legislation. And I'll be joined by three people who will speak to this important topic. First, we'll be joined by Cheryl Bartholomew, who is a mother who gave birth during the pandemic. And we'll also be joined by Patricia, who is co-founder and communications director of the Canadian Perinatal Mental Health Coalition, and also with Jamie Charlebois, who is the co-founder and research director of the Canadian Perinatal Mental Health Coalition. I'm going to open up with some brief remarks and then turn it over to these three people for their comments. Perinatal mental health problems are a significant public health issue, both in Canada and globally. In Canada, 20% of women and 10% of men suffer from perinatal mental illness, and these rates have doubled throughout the COVID-19 pandemic. Early detection and effective treatment are critical for the health and well-being of parents and the emotional, cognitive, and physical development of children. And yet, stigma, poor awareness, resource inadequacies, and service fragmentation represent significant barriers to accessing perinatal mental health screening and treatment across the country. Canada needs a national perinatal mental health strategy to close these gaps in our public healthcare system. There's simply no time to waste. On May 5th, I was very encouraged to see Parliament express unanimous support for my colleague Heather McPherson's non-binding motion, which called on the federal government to develop a national perinatal mental health strategy. Yesterday, I introduced binding legislation, the National Perinatal Mental Health Strategy Act, to make that plan a reality. Interestingly, this bill is a result of the vision of a bright young woman from high school in my riding of Vancouver Kingsway, Mila Mikovic, who was one of two winners of my 2020 Create Your Canada contest held in high schools in Vancouver Kingsway. Now, her idea and this legislation would require the Minister of Health to develop a national strategy to support perinatal mental health across Canada. And that's because, as you'll hear shortly, this is an issue that affects every corner of our country, every community of our country. The strategy would include measures to provide universal access to perinatal mental health screening during pregnancy and the postpartum period, which, as you'll hear, does not happen uniformly now. Ensure timely access to specialist perinatal mental health care services and treatments during pregnancy and the postpartum period. Expand the availability of specialist perinatal mental health community care. Increase public and professional awareness of the frequency, impact, and treatment of perinatal mental health disorders. Improve training for healthcare professionals with respect to perinatal mental health. Ensure access to culturally relevant perinatal mental health care services and treatment options. Ensure access to gender-affirming and inclusive perinatal mental health care services and treatment options. Support the provision of trauma-informed care. Address the social determinants of perinatal mental health. Reduce barriers to accessing perinatal mental health services, combat stigma with respect to perinatal mental health, and finally, promote research on perinatal mental health in Canada. So we are calling on the federal government to work across party lines to fast track this legislation. And today I will be releasing a letter written to Canada's Minister of Health, the Honourable Patty Hajdu, calling on her to do exactly that, to meet with representatives of the coalition and to work across party lines to recognize this issue and to get started on making this national strategy a reality as soon as possible. With that, I'm going to turn it over next to Cheryl Bartholomew for her remarks. Chanel, I think you're on mute.
There we go. Thank you very much, Don. So this is probably a historic moment, but I was among one of the many people who was pregnant and gave birth during the pandemic. As Don mentioned, my name is Cheryl. I'm a mom of 3 girls, 7, 4, and 6 months. I'm a registered massage therapist and health coach. And even though this was my 3rd pregnancy and 3rd delivery, it was increasingly more difficult as the pandemic wore on. Already pregnancy and labor and delivery, those first few weeks post are incredibly tough. Those postpartum weeks and months are hard physically and mentally and emotionally. And with the pandemic and the isolation that came, it was very, very hard for me. And I know for a lot of pregnant and birthing people, it was made almost like way too difficult because we weren't able to have our usual caregivers, our labor support, our postpartum teams, our doulas, our physiotherapists and midwives by our side. I know COVID has kind of brought this awareness of maternal mental health, which is incredibly important, and mental health in general. Because of the isolation, we're not able to connect with certain people that help us through those moments. And especially in the BIPOC and women of color, especially with those 2 groups, we know that there is a higher occurrence of birth trauma, there's a higher occurrence of postpartum anxiety and depression, and it's increased even more so without that village, without that support, without those support people. Maternal mental health is not just about the mother, it's about the child. We all go through it. It's about the family. It's about the community. It's about taking care of your aging parents. It affects everybody. Everybody has been birthed. Everybody comes from a birthing person. So this is not a small topic at all. It is something that affects our entire community, every person, because if my mental health is failing or falling and I need support and I'm not able to take care of myself or my child or my family, it affects every aspect of our community. I was, somewhat lucky enough to not fall too deep into the depths of postpartum anxiety and depression. But even a few days or a few weeks can make a huge, huge difference in how we are able to care for ourselves and others. When you're pregnant, you see the doctor very often. Closer to your due date, you're seeing the doctor every week. They're checking the baby, they're making sure everything is okay. And once you deliver, it's 6 weeks and I'll see you later, right? There's not this follow-up of care. But realistically, having a child is one of the most strenuous things you can do. It's one of the largest injuries that it's going to happen to your body. And we need a team after that to help us get back to functioning, to help us get back to physical strength, to help us get back to emotional and mental strength. If you sprain your ankle, there's massage therapy and there's physiotherapy, and you get 6 weeks or 8 weeks. But when you're postpartum, there's not the same attention. Your hormones have changed, your body has changed, your responsibilities and the pressures have changed. And it weighs very heavily if you don't have a system of support. Many people are not fortunate enough to be able to either afford the support or have the support. And COVID has made that more apparent. When you can't communicate with your loved ones, when you're struggling to say what you need or what you want, you need a safe place to land. You need professionals who know how to help you. Because sometimes your family they don't know what to do, or they don't know what questions to ask. And sometimes you don't have family. Sometimes you're here doing this on your own if your partner or your spouse is at work or away or unable to spend a lot of time with you. They're not seeing the warning signs. So this bill is incredibly important, not just for birthing people, not just for babies, but for the entire community. As you mentioned, Dawn, this is about humanity. This is a human issue that we need to fill the gaps in our healthcare system because it's falling short when it comes to perinatal care.
Thank you so much, Chanel. Now we'll turn it over to Patricia and Jamie.
Chanel, thank you so much for sharing your story. That was very impactful. And it's a story that many people are telling right now. And it's important to continue telling your stories. I am Jamie Charlebois. I am the co-founder and research director of the Canadian Perinatal Mental Health Collaborative, here with fellow co-founder and communications director, Patricia Tomasi. Before we continue, we would like to recognize the many territories of Turtle Island on which we work and reside. These territories are home to many Indigenous peoples who have lived here for tens of thousands of years and continue to live here. As settlers, immigrants, and their descendants, and as visitors, we honor and respect the many Indigenous peoples of this land and hope for a more just future.
Thank you, Jamie. And Jamie and I have some remarks. They're not too long, just a couple minutes. And then we're happy to take your questions. And thank you so much, Chanel and Dawn. Chanel, we're so glad that you didn't fall too far. And we have lots of moms that we have been hearing from who have also stories to tell about giving birth during the pandemic and how they've suffered from postpartum depression. So you can reach out to us if you'd like their stories as well. Perinatal refers to the time period from conception to 1 year postpartum, and that can include prenatal and postpartum depression. That's probably the term you're most familiar with, but there's a whole spectrum of mental health disorders. And we at the CPMHC support Bill C-306, and we're going to tell you why.
I know this has been previously highlighted, but we can't say it enough. On average, 20% of people suffer from perinatal mental illness, but rates during the COVID-19 pandemic have doubled. And this is compounding already underserved area of healthcare. We also know that suicide is the 4th leading cause of maternal death in Canada.
And as Chanel mentioned, Black, Indigenous, and people of color, as well as people with disabilities, gender, and sexual minority populations, they experience higher rates of perinatal mental illness. And Indigenous mothers are 20% more likely to suffer from prenatal and postpartum depression than white Caucasian mothers in Canada.
Without routine standardized screening, 3/4 of people are not identified, and just 10% of those requiring mental health care receives it. Perhaps even more concerning is that if diagnosed, only 15% will receive the evidence-based treatments that they need to recover.
And unlike the United Kingdom, Australia, and many parts of the US, Canada does not have a comprehensive national strategy to guide how healthcare practitioners should assess and treat individuals suffering from perinatal mental illness. Let's put it into dollars and cents for you. In Canada, 1 case of untreated perinatal mental illness is estimated to exceed $150,000 per mother-child dyad. But with screening and treatment, that is reduced to just $5,000.
Maternal mental health can be thought of as the first ACE, or adverse childhood experience, which then cascades into physical and mental illness in the child, which continues for generations. This is a public health crisis.
And we're almost done, I promise. But we just want you to know that we released a report on World Maternal Mental Health Day, May the 5th. It was called Time for Action, Why Canada Needs a Perinatal Mental Health Strategy Now More Than Ever. And in that report, we compiled the results of a first of its kind survey that we did where we surveyed healthcare practitioners across Canada. And we just want to give you a few shocking stats that we found, which weren't all that shocking to us, but we hope are shocking to you. So 95% of healthcare practitioners believe that perinatal mental health services are insufficient in Canada.
87% of healthcare practitioners in Canada do not have mandated screening for perinatal mental illness at their workplace.
89% reported that there are issues accessing perinatal mental health treatment.
57% of healthcare practitioners have not received specialized training in perinatal mental illness.
87% of healthcare providers believe people from diverse backgrounds encounter barriers to care.
And 69% of practitioners reported that COVID-19 has complicated access to care.
We also reached out to provincial and territorial governments and learned that while some provinces have perinatal mental health questions on their perinatal form, it's not mandatory that healthcare providers screen pregnant and postpartum people, except in Alberta and Saskatchewan. But even then, it's public health nurses that screen some of the time and way too late.
Here's what some of our survey respondents had to say about perinatal mental health care in Canada. So someone said, I feel very frustrated and abandoned when we have no place to turn for timely and sensitive support.
And lastly, another survey respondent said, this is a healthcare provider, so a doctor or an obstetrician, said it is past time for a universal perinatal mental health strategy in this country. There are too many people slipping through the cracks. And for these reasons and more, we strongly encourage all MPs to support Bill C-306. Thank you to MP Don Davies and Heather McPherson for leading the charge. It's time for action. We're ready to take your questions. Thank you.